Hi everyone, it's my honor to be invited by ISCP to present our study on career well-being coaching here. I'm Danlin Weng. I'm currently a research student in Dr. Wang's educational coaching research group. The study I would like to share with you here is the effect of group-based positive psychology coaching on female teachers' career well-being in China. We will first briefly go through the importance of female teachers' career well-being, the reason for choosing positive psychology coaching, and the design of our coaching. Then we will introduce the current study and its method and results in detail. And finally, we will discuss our main findings and the future plans. The urgency to address female teachers' well-being stems not only from their demographic dominance, but from female teachers face more challenging than male teachers. Challenges from two dimensions erode their well-being. First, the work-family dual burden. Implementations of the double reduction policy has intensified non-instructional workload like after-school services. Prolonged working hours often coincide with increased family pressures. Female teachers simultaneously shoulder teaching responsibilities, household duties, and childcare, a role accumulation leading to negative spillover effects between work and family domains. Consequently, burnout manifests more prominently among female teachers. Second, gendered expectations. According to existing empirical research, it has been found that job burnout is more significant among female teachers. Due to the more delicate and sensitive traits of female teachers, the stress levels they experience in the workplace and in student behavior are also higher than those of male teachers. We adopt the definition of teachers' career well-being from a 2022 study by Taiwanese scholar who developed a dedicated scale. They conceptualize it as an individual's healthy experiences within their career. Previous research identifies three categories of influencing factors: demographic factors, such as age, professional title, and geographic location; internal factors, including personality traits and social-emotional competence; external factors, like compensation, evaluation systems, and professional relationship. Regarding improvement strategies, existing interventions predominantly focus on teaching-related skill training and improvement plans. Examples include workload reduction program, classroom management training, professional development for coping strategies. Our study straight focus to intervene and enhance the career well-being of Chinese female teachers in primary and secondary school through positive psychology coaching. We selected positive psychology coaching as our intervention for several key reasons. First, existing research confirms its core benefits in effectively promoting employee development and well-being. It works by cultivating positive emotions, which in turn help to build an individual's personal resources, creating an upward spiral of well-being. It's important to distinguish top positive psychology coaching from other approaches. Unlike traditional therapy models, which often focus on pathology and weakness, positive psychology coaching is fundamentally strengths-based and future-oriented. It provides a positive framework for personal growth by developing solutions rather than solely analyzing problems. Compared to other coaching approaches, the positive psychology coaching is particularly effective at sustaining well-being gains long-term. It does this by guiding individuals to view both positive and negative experiences dialectically, fostering a more balanced and meaningful life perspective. Operationally, this methodology fits our context. It's designed for short to medium-term relationship and specifically target professional development and work stress coping. This makes it highly practical and allows for the precise formulation and implementation of action plans. Our study is motivated by the gaps in the current literature on teachers' career well-being. Firstly, existing research predominantly relies on quantitative sources. This approach often lacks qualitative depth needed to fully capture the complex emotional experiences. Secondly, there has been insufficient effort to systematically examine the pathway mechanisms. We need a clearer understanding of how and why various influencing factors actually lead to changes in career well-being outcomes. Thirdly, research specifically targeting Chinese female teachers in primary and secondary schools remain relatively scarce, despite their significant presence and unique challenges within the education workforce. Furthermore, when looking at interventions, previous effort has predominantly focused on teaching-related skill training and improvement plans. There has been a neglect of targeted interventions designed specifically to enhance career well-being for this group. Therefore, we want to address these gaps. The current research comprises 3 sequential studies designed to understand and enhance career well-being among Chinese female teachers in primary and secondary schools. Study 1 employed grounded theory qualitative analysis to explore the influencing factors and develop an initial theoretical model of career well-being for this specific group. Building on Study 1's findings, Study 2 utilized a cross-sectional design. Its aim was to further investigate the mechanisms linking career well-being to risk and protective factors on Chinese female teachers in primary and secondary schools. Based on insight from Study 1 and Study 2, an intervention was developed for Study 3. This positive psychology coaching program was implemented with the dual objective of enhancing career well-being among the targeted teachers and assessing the program's efficacy. For the purpose of this presentation, we will not delve into the detailed methodologies or findings of Study 1 and Study 2. Instead, our focus today will be primarily on the intervention developed in Study 3 and its outcomes. We conducted a 3-by-3 randomized control experiment involving time and groups. Our intervention employed structured online sessions built into meeting. All 57 female participants comprising 21 in the intervention group, 17 in the active control group, and 19 in the blank control group, attended weekly 1-hour meeting for 5 weeks, with camera activated throughout. They will be measured at 3 time points: before the intervention, immediately after the intervention, and 1 month after the intervention. The intervention group participated in a positive psychology coaching group, while the active control group participated in a relaxation training group. Both were conducted online for 5 weeks. The brain control group received no intervention. The detailed coaching program involved 5 sections, including self-awareness, discovering my strengths, gratitude, mindfulness-based stress reduction, and self-acceptance. Now let's move on data analysis. Quantitative data analysis was conducted using SPSS 26.0. Qualitative data from the post-intervention interview of the intervention group participants were analyzed using NVivo 12 to conduct thematic analysis. The effectiveness of the intervention plan was verified by integrating quantitative and qualitative results. Demographic analysis showed that there are no significant differences in measured demographic variables among the 3 groups. These are the measures we use to assess perceived fairness, perceived social support, resilience, professional identity, job burnout, and career well-being. We also assess baseline equivalence across 3 experimental conditions using one-way ANOVA on 6 key outcomes variables measured at time 1. Results demonstrated non-significant between group differences for all variables. Therefore, a further quantitative analysis of the intervention effect can be conducted. Now let's go through our main results. For passive learners, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 2 and time 3, whereas both the active control group and the brain control group show no temporal changes. For passive social support, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 2 and time 3. Passive social support in the positive psychology coaching group outperformed both the active control group and the brain control group at time 2 and significantly outperformed the active control group at time 3. For resilience, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 2 and time 3. Moreover, resilience in the positive psychology coaching group outperformed both the active control group and the brain control group at time 2 and time 3. For professional identity, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 3. Professional identity showed an upward trend over time. For job burnout, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 2 and time 3. Job burnout showed a clear downward trend over time. For career well-being, the results show that the positive psychology coaching group experienced significant improvement from time 1 to time 3. Career well-being showed an upward trend over time. To sum up, key findings indicate statistically significant main effects of group allocation only for passive social support and resilience. This is reflected that post-intervention, the intervention group demonstrated significantly higher passive social support than both the active control and brain control groups. The intervention group also exhibited significantly higher resilience than the active control group. Despite non-significant group effects, all three groups showed significant positive changes over time in perceived fairness, professional identity, job burnout, and career well-being. Qualitative evidence from the 2-month follow-up reinforced our quantitative findings. 5 intervention group teachers accepted interviews. Their feedback further validated the multidimensional efficacy of positive psychology coaching in psychological growth and challenges in life and work. Therefore, the intervention program developed in our study can effectively enhance the career well-being of Chinese female teachers in primary and secondary schools. Now let's move on the discussion of our main findings. These findings indicate that the 5-week positive psychology coaching intervention effectively enhanced female teachers' career well-being and its key contributing factors: perceived fairness, perceived social support, resilience, professional identity, while significantly reducing job burnout. The maintenance of well-being gains align with previous research suggesting the positive psychology coaching helps sustain benefits. This part is the discussion of post-intervention interview. Participants reported significant positive changes across psychological and practical domains. Psychologically, they experienced reduced negative emotions, increased emotional stability and regulation abilities, more proactive behavioral strategies like seeking resources, and enhanced cognitive aspects including greater self-awareness, self-acceptance, self-care awareness, and a clearer understanding of personal strengths in their working lives. Benefits include reduced burnout, improved work reflection and adjustment, enhanced efficacy and work state, and increased overall life participation. These outcomes were facilitated by specific elements of the coaching sessions. Session 1, using the Johari window, first clearer self-awareness. Session 2, focusing on strengths identification, empowered participants empower the participants to express needs confidently, employ proactive coping strategies, and build resilience and self-regulation. Session 3 on gratitude, strength, perceived social support, and professional identity. Finally, mindfulness practice and self-acceptance help participants reduce resistance to past events, negative emotion, and burnout through present moment awareness and acceptance. This finding demonstrated the efficacy of positive psychology coaching in fostering well-being and post-changes in work and life. Now let's consider the limitations of our study and how they inform future research directions. First, a significant limitation was the intervention timing context. To accommodate teachers' workload, we ran the intervention from mid-June to mid-August. This period inherently spanned the stressful pre-summer exam period, summer vacation itself, and the initial return to school. This variation in academic calendar likely influenced the participants' work rhythm, life state, and consequently their responses across our 3 measurement time points. While subsequent qualitative interviews help clarify some of these potential timing effects, these contexts remain a key factors to consider when interpreting the results. Second, the necessity for online delivery presents constraints. Because our participating teachers were distributed across different cities nationwide, an online format was the only feasible option. This likely result in lower group interaction, potentially prevent the intervention from achieving its maximum possible effectiveness. Furthermore, the specific timing of the entire study period also appears relevant for interpreting changes in our comparison groups. The observed positive trend in both the active control group and brain control group over time might partially reflect the influence of the assessment points coincide with the end of term stress and the relief of summer break and the anticipation or stress of the new term starting. These limitations directly point us toward future directions for research in this area. Firstly, future studies need to carefully select intervention timing, scheduling the intervention and assessment within a more stable period of the academic year, avoiding major transitions like exam or holidays, will help minimize the influence of contextual factors on both participation integrity and outcome measures. Secondly, whereas logically feasible, future interventions should prioritize face-to-face delivery. Moving to an in-person format would likely enhance group cohesion and interaction dynamics, potentially leading to stronger intervention effectively. Thirdly, to gain a more comprehensive and robust assessment of intervention effectiveness and its stability over time, future research should collect richer process data throughout the intervention itself, incorporate multiple follow-up time points extending further beyond the intervention end, and include third-party assessment to complement self-report data. This multifaceted approach will provide a stronger test of the intervention's true impact and its longevities. Addressing these limitations through these future directions will be crucial for advancing our understanding of how best to support teachers' well-being through targeted intervention. Hope that you will enjoy our study. If you are also interested in career well-being coaching, please feel free to contact us through emails.